I'm Dr. Marco. I'm a chiropractor here in the desert, practicing over 24 years, and I love what I do. But I consider myself to be a chiropractor plus some. So we're gonna move this joint here. I was born to be a chiropractor. I was born to be a doctor. Move. Now it's lined up. When I was 6 years old, my teacher, Mr. Chacon, introduced to his kindergarten class a box of toys. At that point, I looked in there and I grabbed out some electrical components, and I eventually ended up with a plane that was functional with a propeller. He was so impressed with that he decided to take me to my house and show my mother what I've done. He says, hey, this kid has got a talent for putting things together. It all started, I think, from that little experiment with that motorized plane. All chiropractors develop a great sense of touch, and we can actually find if that vertebrae is either moving this way or that way, or tilting or rotating. So in this case, we find this, and then it's important that we align ourselves with the patient. We get in tune with the patient, and then we move that just like that. Boy, I had every book on dinosaurs you can think of. My sister figured out, hey, this kid likes to learn, eventually bought me a microscope, and then that led me into finding out the microscopic world. I just fell in love with the whole creation process. I think my quest for understanding what life was about started as a kid, and then that led me into other things, into science, and science has been always my true love in terms of learning things. I'm still learning at this age. I go at it with tenacity to find out what's wrong with this person. So I use all of the skills I've learned as a kid and putting it together to come out with the best care I can give them. So, you know, it's been a long journey, and I continue with the journey, and I love what I do. So I spend a lot of my time researching articles, so I love to read. I also like to paint. I'll grab a charcoal and piece of paper and just go at it. You know, I always do kind of leg check here before we do anything, kind of tells me what's going on. You know, chiropractic is all about touch. Another thing I like to do is martial arts. I've been doing martial arts since I was 9 years old. I practice Tai Chi Chuan on a daily basis, which is like a meditative exercise. I think it's an excellent exercise for balance, and this is something I incorporate into my treatment. I teach my patients these exercises, the breathing especially, and this helps with the whole healing plan. And we're gonna move this segment right here. So what I want you to do is take a deep breath. I'm gonna set myself up and then breathe out. Perfect. That was easy. I also like to fish, so on occasion I'm out there fishing. Now, I'm not an expert fisherman, but I love just being out there and out in the natural, the wilderness, and going out there and try my luck. Bend this leg like this. I'm going to place you in position, and then right there. Excellent. I'm just going to move that segment in here. Perfect. So I'm constantly doing something. If I'm not doing that, I'm actually researching new ways on how to treat my patients so that I can bring this back, this knowledge, and share it with my patients.
3 years ago, I gave birth. My pelvis tilted a little bit. I was not able to move at all, so my back was like really bad because the pain was really painful.
So do you think that what we've done here has helped you in some way? Do you think?
Yes, yeah? A lot, yes.
That's the best thing you can tell me, because you know that's what I wake up in the morning, is to help somebody like you that has had chronic pain for such a long time.
You are very detailed. You go through every single thing.
We treat your conditions based on your symptomology. Everybody's unique. We treat neuromuscular conditions and a variety of ailments. We treat shoulder conditions, elbow conditions, wrist, spinal conditions, hips, knees, shoulders. We also incorporate functional medicine in our office. Now here's a type of medical approach and where the patient and the doctor form a team. It's great in treating diseases of the 21st century. I think this is an evolution in the practice of medicine that better addresses the disease process.
Hello, my name is Francisco Moctezuma.
I am the rehab tech at Desert Physical Medicine.
I assist Dr. Casares, helping the patients getting better. The modalities we use in our patients are Acuscope for muscle pain, ultrasound for joint pain, interferential current as an electrical anesthesia, heating pads to promote blood flow, and massage. All of these are key components to helping the patient feel better.
Our next topic, we're going to talk about exercises. Now, When we prescribe a set of exercises for the patient, we got to make sure that the patient is ready to do the exercises. There's hundreds of studies on exercises that prove that exercise is good for the brain, good for the hormones, good for the heart, and good for the health. So exercise is extremely important in this program. And if you really want to go into balance exercises, we go into Tai Chi exercises, which I think is one of the most advanced systems of exercises because it really focuses on what we call the proprioceptors, those receptors in the joints that help us with balance. We believe that if we can cater the exercise to our patient, understand his limitations and work with those limitations, making them stronger, we're going to have an overall improvement in health, coordination, cardiovascular, and mental health. With this approach, we get the best results because, as we mentioned earlier, we engage in getting the patient in this program for their health. It's a partnership, us with them. In the path to health, besides good nutrition, you need a good exercise program, and that exercise program's got to have flexibility, it's got to have agility training, it's got to be cardiovascular in tune. You also have to have a good proprioceptive program to bring you to ultimate health. So exercise for us in this office is extremely important in the recovery process of every one of our patients. My next patient, now this guy is a legend. He's one of my favorites. This guy is a hunter, he's a fisherman, he's an ex-Supreme Court judge, and definitely tough as nails. This patient's been with me for, I think, probably a good 15 years.
I'm JD. I'm a good friend of Dr. Marco Caceres.
JD is a special type of patient that we have to really focus in on what is going on with him.
Over 80. Served in Korea, and served as a policeman, as a judge for almost 57 years. I was an athlete, played ball, and also got involved with martial arts. And a lot of injuries, I mean a lot of them.
Now when he comes into our office, we are standing straight and ready to go, as we do with all of our patients.
I couldn't move my knee, or my back, or my neck. And the most fortunate thing was when I came out to the desert, I ran into another black belt, a famous sensei. His name is Marco Caceres, and he happened to also be one of the greatest chiropractors around.
JD has a special part in my life. You know, he's my hero.
Found him to be an honorable, great, patient man.
When he first came to us, he was in severe back pain, and we've helped him with his back, which has been a chronic problem.
And I had so many back aches and neck aches that I didn't think I was ever going to play ball again, or play tennis, or fish, or hunt. I'm really almost pain-free. I work out almost every day, and it's all due to one guy, Dr. Marco Caceres. I think what you learn is that he's very humble, very smart, very congenial, and he has that great, unique quality of integrity and honesty. He's just a personal friend that everyone I know, some of the high rollers and chiefs of police, really respect this man.
It'll be a great day for fishing. Wow. I got my first telescope when I was about 10 years old. Well, I went into that tangent, and I started to formulate things together, and at the same time I had this spiritual development. After getting out of school, I realized this isn't enough because you got to gain experience. I mean, you may have the knowledge, but if you don't put it into practice, you have nothing. So I realized that I'm starting from scratch. So I had to apply myself to learn everything I can about every disease I can work with and then treat it, and then through trial and error and through going to a lot of postgraduate seminars, I was able to put together a better organized system as to how I can treat the body. I have tools that I work with. We have chiropractic, we have homeopathy, we have rehabilitation medicine, we have a family nurse practitioner, an orthopedist, we have massage therapists, we have exercise kinesiologists. We do it all for our patients to get the best results we can naturally. I want to talk to you about chiropractic. Chiropractic is an art and science of things natural. The nervous system, which is the brain, the spinal cord, and all the exiting nerves, transcourse the spinal column and then control and regulate all the functions of the body. Now, when this system is interrupted, we have the beginnings of disease. My job is to actually open up that nervous system and let the body do what it's supposed to do. We also add traditional Chinese medicine into our treatments. Traditional Chinese medicine tries to rebalance the body, bringing the energy to a homeostasis. This brings about good health. Chinese medicine has been proven effective for many ailments without side effects, and this has been going on for thousands of years. The Chinese are living proof of that.
My name is John Manick. I'm a lifelong golfer, a golf professional, and instructor in the Palm Springs area. I was fortunate enough to start the game of golf at the age of 4. I had always wanted to be a professional golfer due to the fact that my dad was a PGA pro and an instructor, and it was just something I found a lot of passion in. It was really pretty easy for me to be around the game and enjoy it. I had a chance to play junior golf, high school, college, amateur. It led into turning professional at the age of 21. Playing on all the tours, including the PGA Tour and at the time the Nike Tour. I've been fortunate enough to have started a golf school here in the area in 2005 that has blessed me in a way to have a chance to work with people from all over the world, actually, from beginners to professional golfers.
Well, we treat all kinds of sports injuries here. I deal with equestrian riders, golfers, football players, soccer players. John, the golf pro, came to our office. He was in really bad shape. Poor guy, he couldn't swing anymore. He was bedridden. He was very concerned for his condition. But one very important condition that I see a lot is among golfers. And golfers actually have a mechanical problem because they're leaning forward, they're rotating consistently and repeatedly and usually in one-sided. In golfers, it's a joint subluxation in the lower spine, which means the joint is simply locked in position. We're seeing this kind of condition continuously with golfers because they constantly do a repetitive motion that eventually leads to a subluxation.
It was always really pretty easy for me to stay in good shape. Actually, it was part of my day. Playing golf for over 40 years and competitive golf for over 25 definitely took a toll on my body. I was lucky to have never been seriously injured. Not competing as much anymore, aging, and teaching full-time. Having me stand in a 10-foot circle for 8 or 9 hours a day really gave me some issues. It ended up shortening my quadricep in my left leg, which ended up affecting my hips and my back. We got to a point where even when I had a chance to play, I didn't have the range of motions that I used to have. I had pain in areas that I'd never suffered with before. I had to find somebody, and I found Dr. Marco, gratefully.
He ran into that issue with a joint subluxating. He came into our office and we helped him, we fixed him back up, and now he's back out doing what he loves to do.
When I got with Dr. Marco, he was extremely thorough and pinpointed exactly what was wrong with me. And once he got his hands on me and had his therapists do the therapy that was basically exactly what I needed, things got better. I'm back to swinging and playing again, almost like old times. Being able to do what I did over the years, I was privy to working with very good specialists, chiropractors, physical therapists. However, when I found Dr. Marco, he's by far the best I've ever worked with. It didn't take very long to get me back in shape, so I feel very grateful that I've had a chance to work with Dr. Marco. He's definitely the best I've ever worked with.
We don't just give you a medication and think that that medication somehow magically is going to move that joint. This is a mechanical problem that needs to be adjusted, needs physical medicine to bring it back to its normal function.
After being with Dr. Marco, I'm back to hitting 300-yard drives and making 50-foot putts. Life is much better after therapy with Dr. Marco.
The more you learn about the body, the more humble you become, and that leads you into a spiritual path. Good health and spiritual health run hand in hand. You become excited about your health and your direction in your life, and that just makes you more spiritual overall. You can't separate both of them. If you do, you're off balance, because after all, it's your mind that creates the health. If you have a healthy mind, you're going to create a healthy body. Here is a patient that suffers headaches, and usually it's associated with either cervical 1, 2, or 3. In her case, the first bone of the neck tends to slide back and slide to the right. So we're going to percuss that area and bring it into position. So right now I'm just checking the range of motion of that, and sure enough, that's what we find. We're going to use with an instrument very carefully, and then we're going to turn and get that area to rotate more. All right. Very good. Perfect. Perfect. Now here at the office, we practice functional medicine using a combined approach: chiropractic medicine, homeopathy, traditional Chinese medicine, physical medicine, and that encompasses modalities such as ultrasound, diathermy, interferential current, laser, or what we use, exercises, guided exercises, weight management. We use techniques such as Tai Chi or Qigong, which is that's another thing I love to do because it's something I actually learned as a young boy and became eventually a martial artist. I am a 7th degree black belt, and I still teach martial arts, so the combination of art, science, and philosophy has made me, I think, the better doctor, the doctor that I am to help my patients. So I want to welcome you on this journey to optimal health, and I'd like to say whole body healing for an optimal life starts with a combined approach. Not one medicine works. I think if we can combine the best of therapies, we can give you an idea what we can do and provide a solution to your health problems. So welcome to this journey. So now this next patient that we're going to talk about, all my patients are special, but this one, this is Lois. She's 91 years old.
Hi, I'm Lois.
Lois had an unfortunate accident where she fell from a stool while in a restaurant. She thought she broke her back. She was seen in the ER. They medicated her. There wasn't much else she could do. She tried some physical therapy, but that wasn't enough. She came to us in a wheelchair with a walker on the wheelchair.
I'm in my 91st year. I live in a very active community. I live in a gated senior park, and we have many, many activities. I play cards a couple of times a week. I play pinochle 1 day a week.
She wanted to get back to what she was doing even at that age of 91. So we've been treating her with a specific protocol of care which has brought her back her function and her way of life.
I belong to the knitting and crocheting group. We call ourselves the Blanketeers. There's even a poker group call themselves Texas Hold'em, and I love it. This is a paradise to me.
She couldn't do much of anything, so we started her on a specific treatment, carefully adjusting the spine until we got that correction.
I need to let you know that I really enjoy my golf cart. It's kind of a fun thing. I can zip along these roads here. I've named her Jewel, and of course she's a female. Through the years I've had a couple of car accidents. I fell backwards from a high stool on my back. Through all of these accidents, I have met Dr. Marco, and to be honest with you, he's my guardian angel.
Well, Lois now is back on track. She's walking, she doesn't use a walker, and we did this basically with no medication, all physical medicine. Now this is a success story. This is what we want in every patient, and this is what makes my job give me such satisfaction.
I respect him so much. He has done so much for me. He's the only doctor or person that I've gone to when I could hardly walk and full of pain. Today, I am pain-free and I have hope. And it was because of his attitude and the advice that he gave me and treatments that I am now walking again. He's tremendous. I can't speak enough for him. I just can't sing his praises well enough. He's intelligent, he's smart, but he's full of hope. And he's funny. I really love him. I think he is a spiritual man. He is so smart, he's so intelligent, but he's got one of the biggest hearts that I know.
The innate intelligence that you have can actually heal the body naturally. Now, if we can enhance that, now that's natural healing. That's awesome. That's what we want to do for you. In this case, we have a foot condition, and this patient has been having foot problems, but then affecting her, eventually leading to a limping situation.
So right now I'm going to do ultrasound over the right ankle.
So what we have to do is address the connective tissue, which is the articular cartilage that's holding the joint in its improper position, which is also swelling. And then we have to address the soft tissue, such as the muscles that actually connect to these joints. You can't adjust a joint when you got all the connective tissues around it swollen and stiff. So in this case, we have 3 joints we have to adjust, and we're going to do it manually on some and also with an instrument, which is called arthrostem. As you can see how this moves, and the more pressure I put, the more foot-pounds I can do. In this case, it's about 15 percussions per second. All right, this is Jorge Romero. He's got a mid and lower back problem. He works for the Coachella Valley School District. He's their main guy. He pays everybody. This is where I'm going to right now. Y'all ready? All right.
Hey Doc, what's going on? It's Lee. I really appreciate how you guys run your business. So thorough and professional, and I'm very impressed. I haven't been to a doctor's office that's been ran like that, I don't think ever. So I wanted to tip my hat off to you. That's no lie.
So thank you very much. The results were just excellent. I can't express how much I'm very happy.
No,
honestly,
thank
I've
you.
gotten the past couple of days.
It's a
been
pleasure.
Awesome.
Because you've only seen me, what, twice?
This is the second time, and I've improved. I mean, I've been seeing other chiropractors, and nothing like this. Nothing. It's a huge difference.
Yeah.
Just so excited. You're great. You're a wonderful person.
Have you noted any changes in your movement?
Absolutely, total more movement. I would say 80% better. A couple more treatments, I'll be good.
How about sleeping?
Sleeping amazing.
Yeah?
I'm very happy. Yeah.
Hey man,
Absolutely.
that's the best news you can
Best
get.
news. I'm very happy.
Thanks
Thanks
so
again.
much.
Man.
All right.
You're an awesome guy.
Take
Thank you
care.
very much.